You want to live life on your terms, have the freedom to do what you want, when you want, without inconvenient and sometimes painful or embarrassing moments brought on by bladder control problems. There may be hope, even if medicines or other treatments haven't worked. Medtronic Interstim therapy has helped many people with bladder control problems achieve newfound freedom in their lives, and it may help you as well.
It represents a different approach, different from using drugs.
Such an amazing sense of freedom. I can go out and have dinner with friends and not get up.
Years ago, I couldn't go. I was in retention all the time. Today, looking back, I would say that I'm back to a person that doesn't have retention.
I now can control whatever I want to do, and it's made my life free.
In this video, you'll hear from people like you who have struggled with bladder control problems. You'll find out what Interstim therapy is and learn how a test of this therapy can let you know whether it's right for you. For the millions of women and men who suffer from urinary control problems, life is a struggle for normalcy, especially when treatments such as drugs, exercises, or use of catheters don't improve their symptoms and quality of life.
When you have incontinence, your world revolves around trying to find a bathroom. I go out with people, but I couldn't even focus on what they were saying. The only thing I could think about was the door behind him that said restroom on it. It's really embarrassing.
I couldn't even concentrate or drive more than 15 minutes without having to stop and use a bathroom. Just going to work, I'd have to stop 2 or 3 times. And, you know, what do you do? Do you go into a restaurant and buy a cup of coffee or what? What do you do? It gets to the point where you don't even want to go out of your house. You want to stay in so you can be near a bathroom.
We did a lot of medicines, a lot of stuff to even make me go to the bathroom. And that didn't work either. I had to make sure that I had little catheters with me at all times, make sure I had medicines I was supposed to be taking, and there was big planning. And, you know, I thought it was going to be like that the rest of my life.
It may not have to be a lifetime of frustration and ineffective treatments for you. Even if past treatments for your bladder control problems have been unsuccessful, Interstim therapy may work for you. Interstim therapy has helped many people regain freedom and control in their lives. Interstim therapy is an FDA-approved treatment for urinary retention and the symptoms of overactive bladder, including urinary urge incontinence and significant symptoms of urgency frequency in patients who have not been helped by more conservative treatments or who could not tolerate those treatments. This therapy uses a small implanted stimulation system that includes a neurostimulator and a lead. This system provides electrical stimulation of the sacral nerves located near the tailbone. The sacral nerves control your voiding function.
Another significant advantage is that it can be tested, and we can know ahead of time which patients the therapy is likely to benefit. And lastly, once the therapy is started, it can be turned off.
The first step is to see your physician. You'll talk about the past treatments you've tried and their results, and have a physical exam. At this point, your physician will evaluate the potential benefits of treating your condition with Interstim therapy. The best way to determine if Interstim therapy will work for you is to try the first stage of treatment called the test stimulation. This involves surgically placing the test stimulation lead under the skin near your tailbone and attaching it to a portable stimulator that you can wear on your belt. You then wear this device for a few days to see how the stimulation affects your symptoms. If you get good symptom relief, long-term therapy can be considered.
The test stimulator is wonderful, and I'm glad that I had a chance to try it so that I could see for myself if it was going to work.
Placing the test stimulator lead is a fairly simple procedure and usually takes about 30 to 60 minutes. First, your physician will numb an area above your tailbone with anesthetic, and using a needle will carefully insert a lead along a sacral nerve inside your body. Then you will be asked some questions about what you're feeling to confirm that the lead is in the correct position. Once an appropriate response to stimulation is verified, the lead is secured to your skin with an adhesive dressing and is attached to a device called a test stimulator. Your physician will show you how to turn the stimulation off and on using the test stimulator. You can then go home and resume your normal activities with a few restrictions. You may experience some discomfort or soreness where the lead is placed. If this occurs, talk to your physician. You will also be asked to keep track of your voiding symptoms and frequency of voids in a voiding diary. This information is critical in helping to determine the effect of the stimulation on your symptoms.